Hello, this is Dr. Gay from First Second MRI, and this is a 52-year-old female who had pain in her forefoot beneath the second toe, and there's some swelling there. It feels like a soft tissue mass. She's had it for many months and she's never had time to come in until recently, and now she comes in. We have an MRI of her foot, and we're really looking at this area right here. We can see where the problem is. This is the second metatarsal bone here, and this is the metatarsal head. This is the second toe here, so this is the metatarsal phalangeal joint. This is the plantar aspect of the foot. You can see the plantar fascia here coming along. So this is right beneath the metatarsal head or the MTP joint. Now when we see something down here, we always look for the plantar plate, because one of the things that can cause inflammation or edema or abnormal signal down here or pain is the plantar plate. So the plantar plate comes underneath here, and it on the plantar joint capsule, and we can see this linear dark band is intact. So there's no evidence of plantar plate tear. And another thing that can happen here between the second and third metatarsal heads, here's a third, and there's the second. And right between them, you can get inflammation here. It can go down along the plantar aspect, and we call it a Morton's neuroma when we see inflammation in here. A Morton's neuroma or perineural fibroma. And so they could have some inflammation, but this really is away from that. It looks like it's beneath the second metatarsal head. It looks like it's something separate, predominantly within the subcutaneous fat. So the fat should be bright, and right here it stops being bright. We see this glob, inflammatory glob. So this is the problem. We're going to look at this in another view. We'll look on a fat suppressed view. So on this view, we're going to see the plantar soft tissues here. The fat is suppressed, and we're going to look for that area. It really doesn't stand out so much, but it really is right in this region. This is the second metatarsal head here. So this is the area, and this area is a little bit bright, not that bright, but here's the area of concern. This is right beneath the skin surface here, and this is that inflammatory glob, but you can see how it does not stand out nearly as nicely on this. Now we're going to put up another view, a T1 view, where the fat is bright. Now we move the toes upwards here, and on this view we can see the second metatarsal head, third metatarsal head. We see a little bit of gray tissue here between the second and third metatarsal heads, and a Morton's neuroma or perineural fibroma can look just like this, a little mound of gray tissue, but this thing is something beyond that. It looks like it goes out here further. Sometimes you can have Morton's neuromas that are really big or exophytic. This is unusually big, and the epicenter really is pretty far away from here. Now we're going to go to another view here. We're going to go to a short axis axial view like this and slice through it in short axis. Now in this view we see the first metatarsal head. These are the hallux sesamoid bones here beneath the first metatarsal. Here's second, third, fourth, fifth metatarsal shafts. As we go distally, we're getting into the heads. We're going to get really close to the area of concern now, which should be down here. We keep rolling. Whoop, there we go, right into the dark gray tissue here. Again, you can see the fat should be bright, and here we have this gray infiltrator process. It comes out of here and goes down. Really stands out better here. So some inflammatory process. And now we're going to put up one more view. This is a fat suppressed sequence, and fluid will be bright on this. We call this a fat suppressed proton density sequence. Again, the fat now is dark. It's been suppressed, and little tiny bits of fluid here in the joints are bright. And on this view, we see something really stand out now. So with the fat dark and the fluid bright, we see this little round ball is right beneath the skin surface. And this changes things a little bit. When you have a fluid collection in this region, there's a couple things that can be. One is called an epidermal inclusion cyst. Sometimes people can have a puncture wound, and a little bit of their epithelium can get trapped in here, and it will form a little cyst. Or sometimes they have a little sliver that goes in there, and the sliver gets caught, and it forms a little abscess or a cyst in there related to that. There's a subtle little dark band right here along the margin. This could be a tiny sliver. She didn't have any history of a puncture wound, though, or this could just be a little band of fibrosis or scarring. But there's a little round ball here, so this may be, again, an epidermal inclusion cyst related to prior trauma. That's probably what it is, since it's so round, so right beneath the skin surface there. Perfect location for it. Now, another thing this could be is what we call adventitial bursitis. Sometimes you can have increased stress, abnormal mechanics of stress, and you can have inflammatory response and a mound of inflammation, scarring. And then a fluid pocket can accumulate, and this is what we call adventitial bursitis. So this is one of those two things, a little epidermal inclusion cyst or adventitial bursitis, and maybe there's also a Morton's neuroma here. Can't really see it on this, but you can see it on this one here, possibly, or inflammation there that's blending with this. So an unknown case, the podiatrist has talked to him. He's going to go in there and maybe take a look and see and get back with me. So if I have any update, I'll let you know, but interesting case here of this inflammatory process in the foot that's been there for many, many months, and thank you very much.